Good afternoon, Professor. So today I'll be covering anxiety from my project number 5. So who is the patient and what's their story? Kristen is a 38-year-old woman and a single mom, mother to two children. So her story is despite being in a relatively stable job, she cannot shake the fear that she will soon leave it and being unable to provide for her two children. Kristen finds herself feeling restless, unable to do her job effectively. This issue has been going on for the last 8 months, and the negative thoughts continue to haunt her. Next slide. So, the diagnosis and signs of symptoms. From what the patient describes, it's apparent that she suffers from anxiety, the constant worries, fears, and feeling overwhelmed, unable to do daily tasks, unshakable thoughts that bad will happen. These are all telltale signs of anxiety and definitely troubles her, prevents her from doing her day-to-day task. So some additional signs and symptoms are sweating, hyperventilating, shortness of breath. The patient may experience increase in pulse, avoidant impatient, avoidant behavior. They want to get away from the what's stressing them out. GI distress, which means they can feel the sudden urge to use the bathroom in the current moment, and a lack of sleep can also be a sign of anxiety too. So the pathophysiology of anxiety disorders is neurotransmitters such as norepinephrine, serotonin, dopamine, and GABA. These are all involved in mediation of anxiety. However, if there's an imbalance in the brain, these can all lead to anxiety disorders, just how Kristen has. So anxiety typically begins due to a fear. In Kristen's case, it's the fear of losing her job and being homeless and being unable to provide for her two children. It is diagnosed when a patient has consistent worries, check, fears, check, thoughts something bad will happen over a time span of 6 months, also check. So, anxiety can cause the fight or flight response, which consists of increased heart rate, increased respiration, increased blood circulation. In the wild, humans typically experience those things in response to, let's say, for example, a lion or wild animal trying to attack them. Unfortunately, in Kristen's case, instead of wild animal, she's dealing with stress from work and possibility of losing her job. So the medication classification, some medication that treat anxiety are escitalopram, which is a SSRI. The mode of action is it blocks the reuptake in serotonin in the brain, which increase the levels of serotonin in the brain, which has anti-anxiety effects. Lorazepam is a benzodiazepine. The mode of action is potentiating the effects of GABA, which then in turn has muscle relaxation and anxiety relief actions. How the medication will help the patient's condition slash problem. So the goal of these two medication is to promote muscle relaxation and the calmness in the mind. In doing so, the patient be able to worry less and compose herself as she goes on about her day. This will also include her quality of life because minus without the additional stress, she's able to clear her mind, focus on her job, and make sure she keeps it in order to support her two children. Some non-pharmacological interventions or coping mechanisms the patient can do is my personal favorite listening to music, stepping away from the situation and returning when she's nice and composed, talking to a therapist so she has someone to talk to and discuss her problems so they can guide her as she mediates her issue. She can try doing some deep breathing or yoga. That's are also great exercises. She can try getting enough sleep to relax the mind and get enough rest. She should refrain from CNS stimulants such as coffee. She can take a walk and again exercise, which definitely keeps the mind occupied. Another thing she can do to keep her mind occupied is perhaps read a book, study, draw. All those things are pretty good for keeping the brain busy. So, additional uses or side effects for the medication, starting with escitalopram, the patient could potentially experience vision loss or vision problems. They can experience dryness of mouth, sweating, low appetite, They can experience difficulty urinating and seizures, which is definitely not good. Escitalopram is also used to treat major depressive disorders such as depression. Onto lorazepam, what it can do is it can potentially slow down respirations to a dangerous level. The patient may notice dark urine, which could be an indicator of hepatic issues. The patient can experience jaundice, yellowing of the skin and eyes, which is a sign of liver issues, which is definitely not good either. The patient can experience drowsiness, memory issues, and constipation too. Those are all things we should look out for. Patient teaching for the medication for her anxiety as well for medication to manage HDND and hypertension. What she can do to mediate this is take some days off of work to relax, have fun with her two kids. Um, she should make sure to follow the medication regimen and don't stop cold turkey. This can potentially lead to potential maybe withdrawal system. The body is used to this medication. Stopping it immediately is definitely not good. The medication can take some time to show results, so educating her to be patient. She should definitely not take ADHD medication close to bedtime because CNS stimulates the mind, and if you take it right before bedtime, it's gonna disrupt the sleep cycle. So members of the interdisciplinary team that she can talk to is a psychiatrist or a psychologist. Psychiatrists diagnose the issues. Psychologists more give some treatments such as CBT. She can also talk to a social worker about some resources or people she can reach out to help her with her issues too. And that's the end of my presentation. Thank you for sticking along. Right now I'm looking at my sources. And also, Professor, have a nice winter break. At the end of the slide, I also send a link to my favorite song about anxiety. Definitely check it out. Take care.